Hi everyone, welcome to another Jodi Dancers Talks podcast with us. Today we've got Aisha from the Adar Project. Hi Aisha.
Hi, thanks for having me.
No problem. Thank you for joining us. We really appreciate it.
Yeah, no worries.
Yeah, and so basically, guys, just a little backstory. So from our social media research and looking online and stuff, we came across the Adar Project, and I thought it'd be a really good opportunity for Aisha to speak about the Adar Project. So I just want to start off, Aisha, just by basically saying, like, how did you start this project? So for people that aren't aware of what you do, where you started from, if you could just give a little backstory.
So we're a mental health charity in Leicester City, and we've been around for a really long time. So since the late 80s, basically. So I haven't been there for that long. I think I've been with Adar for well, coming up to 5 years now. But yeah, so it's really been kind of a fixture in the community. So in the late 80s, there was a steering group from what was then a mental health unit at the Leicester General Hospital. There was a consultant psychiatrist and I believe kind of staff from South Asian background from the voluntary sector and from like kind of local communities. And also I think there's a few people with a council. So they set up this group. So there was some concern following the race riots in the 80s. So, just very briefly, what was happening at that time. So, young Black people reporting feeling really targeted by police with stop and search policies. There was high unemployment among minoritized communities. And of course, that kind of marginalization, that's a contributory factor to poor mental health. And then the other thing that was recognized was an increase in the number of South Asian people who were presenting with depression, but they were facing language barriers and institutionalized racism in kind of statutory services, if you like. So the Adha project, so this group was a response to seeing if we could help to meet the needs for those people in our communities. So there were four voluntary projects established at that time, and then so it was 1989 when that group was ratified and constituted, and Adar Project as a charity was then established. And the ethos really that kind of still exists today is that it's user led. So it's about giving voice to those who are marginalized, in so many ways. So with their mental health, with their ethnic background, and it's about valuing kind of their insight and their lived experiences. So that's the history that unfortunately I wasn't a part of, but that's what I have learnt.
No, that's quite interesting. So I just want to just touch on it because obviously you said the race riots in the 80s. Obviously, the current climate we're in right now, it's not
Yeah,
as bad as that, but it is getting to the point where we've seen like quite a few brown women that
Targeted.
have been targeted,
absolutely.
rape in
Yeah.
Albury,
Aubrey.
sexual assault in Warsaw. So there's quite a lot
Mm.
that's happening now off the back of what we've seen in the summer. Have you, just off on a tangent, have you seen an uptake in your services then over the last, let's say, 6 to 12 months as a response to what's been happening?
As a response to what's been happening, um, I'm not sure that in the service. What we have in the service is we have people who've been coming for a really long time, so people are quite kind of well established. I mean, certainly people come and they've of course experienced racism in various ways, not just in the last 6 to 12 months, but throughout, it could be throughout their careers or throughout their you know, their lives really, and that has an impact, of course. I don't know if we can see as yet whether there's an increase in response to that, but we might see that later down the line.
So back to what we're talking about the services that are on offer. What do you? I know it's user led. What are your main services that you see that are being used currently?
Well, so we're a very small charity, actually. I think there are maybe 10 of us, and we all work part-time, so we are very small, but we kind of give as much as we can, really. And the aim is to provide support to those suffering with their mental health. So in our minoritized communities, although actually we don't turn anyone down at all, regardless of their background, as well as kind of carers and even professionals, at times we try and give support to. So the main services are we run support groups for people with mental illness, and that's based in Leicester City and Leicester County. And the aim with that really is to essentially reduce social isolation. So we hope to provide a safe space for people where they can come, there's no judgment, you can be yourself, and you cultivate connection, and hopefully we work to break down stigma in that. So that's a really important part of that. We offer therapy, so CBT, which is what I do. We also offer counselling and emotional support. That's one-to-one. So we offer that in a brief way. And we work with people when they're struggling with depression or just low mood, anxiety, stress, low self-esteem, sometimes trauma. We have one of my colleagues is a menopause champion. So that's really something that's come up recently. You might have seen that kind of around and about on social media. So really kind of understanding the impact that has on women, and even then families, and how that can impact. So recognizing symptoms, understanding the impact of the strain of menopause on your body and on your mental health. We have an advocate. So our advocate provides assistance to those with mental health problems who aren't sure of their rights and their entitlements and what support is available. It could be practically, it could be financially. So we have an advocate who is very experienced and can give that kind of support. And we also run workshops to community organisations. So mental health awareness workshops, again, about providing education, awareness, reducing stigma, about things like what positive mental health is and what isn't, because there are lots of myths around that. How to look after our, tips, for instance, on how to look after our mental health as part of our overall health, and also staff support workshops for community services. So you might have, for instance, a young person's service. Say it's a young person's service, it's an art service. So they're helping young people to be creative and to develop in that way. But they will often see young people who then present with mental health struggles. And that so then actually, staff are then kind of trying to help and support, not just to develop that young person's creativity, but also actually to try and help them and support them in their mental health. And so we can offer those kinds of workshops to staff as well. So that's probably our main avenues, really.
Yeah, so with that, there's just sort of two things I want to touch on. I know Rav wants to touch on on the menopause thing in a moment. Before we do the isolation one, which is quite interesting. So the natural default stereotype is it's the elderly, but after COVID, especially, what have you seen in terms of that sort of service you offer for tackling isolation?
Yeah, we've definitely seen, an increase in loneliness and social isolation. So definitely, I think that's happened, and it is particularly prevalent with the elderly, but also again with those with mental health problems. And one of the things that, and I say this often, is that there is decades of research to show the link between social isolation and depression. It's really strong. And so we know that that's one of the big things that if we can kind of bring people together, help them to connect with each other. So for instance, our support groups will, we have kind of art teachers coming in to do some work. We might have a dance teacher coming in. We have a Tai Chi teacher coming in. and you bring people together with that. Often I've heard service users saying, "Well, I look forward to this throughout the week," and that just feels so important.
100%.
Yeah, and in regards to the menopause that you touched on, we recently did a workshop around that. So we went and did like a session, and then there was menopause talk after. And we know it's quite like a topic that's not spoke about much,
Yeah.
and I feel like it should be. So, how have you found the uptake to those sessions? How are they, and do people feel comfortable when they're in that environment to then speak openly about their sort of symptoms and struggles that they're going through?
Yeah, as I said, one of my colleagues is the menopause champion, so she would be able to kind of give a little bit more insight. But certainly, it's something that when I've done mental health awareness sessions, it's definitely something that I open up, and it's really interesting. I find that once you start to open up about it, and people start to relate to it, and then be then and if you can create a safe space to actually say, yeah, we all struggle with this, as women, we've struggled with this, we've some people have gone through it all, some people are just starting, some people are not there yet.
Yeah.
But I think we have I think it's nice to see that people can start to be open about it, and just really kind of, because it can have such a massive impact
Yeah.
that isn't spoken about and isn't thought about. So I think it's nice to see that, really.
Agree, and I think it is it's a topic, and I think as women we tend to just when we're feeling sort of things, or we have sort of physical attributes, or whether mental, sometimes we just think, oh, it's just part of our life, we've got to deal with it, but it's not as easy as that. So having that space for women to come together and be like, I've gone through this month, or this has started for me, it does make a massive difference, because then it just makes them feel like they're not alone, and
Exactly.
they are going through things that other people are going through, and they've got that space. So it is good to see, and it is nice to see that more and more women are being able to talk about it, and freely talk about it as well.
Yeah, and hopefully we can continue to offer a space to be able to do that, really.
Yeah.
Yeah, and I think just on that, because I think you talked a lot about your services. I just want to ask you a question in terms of obviously being a small charity. How can people support you guys, especially in your local area of Leicester? But how can people support you guys in terms of all the good services and offerings that you have?
Yeah, okay. So this is where I plug a little bit. We're always looking for volunteers, right? And at the moment, one of the things, we're really looking for volunteers to help us with IT support and administration. Now, that doesn't sound very exciting, right? And I get that. But if it wasn't for help with IT support and administration, the service doesn't run properly. Right. So people who can support us with that, they're the cogs that keep us working, if you like. So if there is anyone who can offer anything like that, a few hours a week or whatever, then that would be really great. Um,
Yeah, I like that because I think everyone assumes like automatically it's donations, but
Yeah.
it's people on the ground,
yeah,
volunteer time, hours just to help things run more smoothly.
exactly. That's right. And as a small charity, you always, I mean, anyone who works in the charity service will know that it's always a real effort to get funding.
Mm.
Um, and again, things like administration and IT support can get lost in that. But we can't provide
Mm.
support groups, we can't provide therapy, we can't provide advocacy, we can't provide any of that without that administrative support. So it's really invaluable, and absolutely, on the ground, that not that if anyone wants to make a donation, please do.
Yeah,
We're
yeah. We're not
not,
saying don't donate. We're saying like obviously as opposed as well as.
yeah.
uh,
Yeah. We can also, so we do things like, so we just had, because World Mental Health Day is every year on the 10th of October. So we always have a big event on those days. We always are able to thankfully throw our service users a Christmas party at Christmas time. Well, it's kind of an amalgamation of Christmas and Diwali and Eid and Vaisakhi and everything kind of together. And we we'll have raffles and things like that. So again, donations of gifts, if that's a possibility for people, that kind of thing always kind of is. Again, it seems small and not very exciting, but actually it goes a long way with us. So yeah, that's, those are the kinds of things. People can always reach out. So we're on kind of the social medias. We're on Blue Sky and Instagram and X and Facebook. So people can reach out.
Yeah, and I just want to just wrap it up there. Thank you for your time, Aisha. And I want anyone that is in the Leicester area that is suffering mental health, or even more importantly, if you've noticed someone that has a change in symptoms and that needs support, make sure you reach out. We'll put all the, like Aisha said, with all the social media, we'll put all the information in the caption below. Make sure you give them a follow, support, share. And thank you for your time, Aisha. Thank you very much.
Thanks for having me.
Thank you.